PCI during cataract surgery can be a nightmare. We'll be discussing the steps of phaco-fragmentation post a nucleus drop. Whenever a nucleus drop happens, make sure you do a good anterior vitrectomy and put an IL if possible. Before making the ports, look for choroidals. Inject a balanced IL solution if necessary. Start irrigation before after checking the tech only. Do a good port side anterior vitrectomy. Remove the vitreous from the anterior chamber. Remove the cortical matter before going into the vitreous cavity. Relieve the nucleus of all the vitreous around with a high cut rate and a low vacuum. Once you are able to relieve the nucleus from the adjacent vitreous, then you can try to induce a posterior vitreous detachment with a triamcinolone assisted technique. Use a irrigating lens under high magnification and high vacuum. Induce the PVD. This prevents intraoperative complications like retinal break formation by avoiding inadvertent pulling of the vitreous. After this is done, PFCL injection into the vitreous cavity is done to protect the macula and the disc from the falling of the nuclear matter during the procedure. Make a MVR incision which is around 3 mm away from the limbus, and once you have made a peritomy, you can go in and with the help of a phaco-fragmentome at vacuum 80 to 150 and a power 50 to 80, depending upon the hardness of cataract, do a phaco-fragmentation. Make sure that the nucleus does not fall many times to avoid damaging the retinal part. Try to keep the nuclear matter at the tip of the phaco-fragmentation as much as possible. After the phaco-fragmentation is complete, the wound is sutured, the PFCL is removed, peripheral indentation is done to check for any inadvertent break formation or a iatrogenic break formation, post which a fluid exchange is done. After phaco-fragmentation, SFIL can also be done by using the same ports and trying to remove the haptics from the ports itself and tucking it in. So the take-home message is don't panic, keep calm, suture the wound always, do phaco-fragmentation as soon as the cornea is clear. Periphery should always be checked for an iatrogenic break. Thank you so much.